Hi, everybody. My name is Regan Gale. I'm a clinical psychologist. I've had the great privilege and pleasure of um, working in Whitehorse for about the last 10 years. And I'm sorry this afternoon that I'm not able to join you kind of live. We had some technical difficulties. So I'll be recording this presentation. It will be uploaded and available to you tomorrow. So I'm just going to share my screen. Here we go. So what I'm going to be presenting on is mental wellness beyond midlife. One of my favorite things to talk about, actually. So I'll start by thankfully and respectfully acknowledging that the lands on which I get to work and live and play and dream and think and do everything that brings me meaning. This land is the traditional territory of many diverse Indigenous groups. Tonight, I'm joining our meeting, this call from the traditional territories of the Anishinaabe, Haudenosaunee, and Huron-Wendat. But in Yukon, all of the different Yukon First Nations, I am grateful and pay respect to Indigenous cultures across our Turtle Island. So in this afternoon's presentation, rather, this is what I hope we learn, we take away. So we're going to talk about common mental health conditions or challenges and how they can be different in midlife and in older adulthood. We'll talk about what changes may be normal as we get older. We'll talk about how we think about aging affects our mental health, which is super interesting. We'll talk about the potential interactions between our medications and our mental health. And then finally, we'll talk about mental wellness promoting factors. So that's what we have in store together. Okay, so first, before we begin, here are some generalized risk factors for developing a mental health problem or condition in midlife or in older adulthood. One of these is hearing loss, and hearing loss appears to be a particular risk when we develop hearing loss in midlife. That is to say, what I would say to anybody is if you're experiencing hearing loss and you're able to have it addressed through hearing aids, it's always the right time to do it because hearing loss is important for more than just your hearing. It's important for your mental wellness. Being socially isolated and feeling lonely are also risk factors for mental health challenges. Chronic health conditions like high blood pressure, obesity are risk factors for mental health problems in older adulthood. And the other interesting thing is not having gotten as far in school is another risk factor for mental health problems in older adulthood. So I'm going to start by talking about depression and anxiety. Maybe some of you will have watched my previous presentation about more than worry, all the various ways anxiety can show up in our lives and maybe some things that we can do about it. I often talk about depression and anxiety together and say that they travel together. It's like a braid with only two strands. They're often woven together. And they both can affect our thoughts, the types of things we think about, the emotions we feel, and what we do, how we behave. Importantly, for this presentation, sometimes as we get older, especially as we get into older age, feeling sad is not the primary or even the main symptom of depression. So for some older adults, although this can happen earlier in life, it becomes more likely as we get older. For some older adults, depression doesn't feel like sadness or feeling low or feeling down. Instead, it can feel like we're numb or like we're not interested in anything. There can be feelings of hopelessness and helplessness. or irritability, increased frustration and anger. So this is all important because I have worked with clients who said, I'm not depressed, I don't feel sad. But in fact, they are depressed. Just as we get older, depression shows up, can show up in very different ways. It's not always sadness. We know that we have a higher risk of developing depression and anxiety in middle age and beyond if we've had previous challenges with depression and anxiety. So unfortunately, if you've had depression in the past, you're more likely to have another depressive episode in the future. And the same kind of thing is true with anxiety. So it's like a double whammy, but it's important to know because it can help us manage our mood. There's also a higher risk of developing depression and anxiety if we have certain chronic health conditions. For example, depression is very, very common in people living with Parkinson's disease, but also after having had a stroke. Conditions like cancer and multiple sclerosis are also significant risk factors for developing depression and anxiety. I'll go back, and all of those things are important to say because as we get older, our risk for developing those conditions also goes up. So now I'm going to talk about challenges with substance use as we get older, as we get into midlife and beyond. What we know is that the use of recreational substances, I have illegal drugs on the slide, the use of those types of substances tends to decline around midlife. But what we know is that in midlife and as we get older, many adults continue to struggle with other types of substance use. So substance use is a significant mental health issue as we get older. And we often think about substance misuse as a problem of the young. Not so. It's perhaps just that there are different substances that become problematic depending on whether you're in your 20s and 30s or in your 50s or 60s or 70s. So in particular, as we get older, we see more challenges with problematic substance use in pain medications, in cannabis and marijuana, but I would say most concerningly with alcohol. So alcohol is the drug most often with which older adults and adults have the most frequent rate of substance use difficulties. So the type of drug with the highest rate of substance use disorder in older adults. So why is this, why are we talking about substance use in midlife and as we get older? One of the things that makes substance use challenges different as we age is that our bodies get older and our body's ability to process or metabolize or break down those substances also changes as we get older. The same way our body changes in all sorts of different ways as we age. So as we move beyond midlife, our bodies can't absorb or break down substances as easily as they once did, which can lead to a whole bunch of other problems like interactions with our medications or other chronic health conditions. What I wanted to say here, though, is that it's never too late to stop using substances or even to use perhaps in a healthier way. What we do know is that people who are able to, I'll talk about alcohol specifically, stop drinking alcohol and maintain that abstinence from alcohol often experience a real increase in their physical and mental health. And the neat thing is that that increase can bridge like 5 to 6 years. Like things get better and they get better. Like anyway, it's pretty exciting. So if that's something you're interested in, I know that there are lots of supports provided by mental wellness and substance use services for adults who wish to have a different relationship with the substances they're using And that goes for Yukoners no matter how old they are. Now I'm going to speak a bit about trauma as we get older, as we get into older adulthood. So trauma isn't unique to childhood. Traumatic events can occur at every age, at any age. There is some people believe, and I don't disagree, that as we get older, we're more likely to have had repeated exposure. We're more likely to have had more than one or more traumatic things happen to us. So there can be kind of a building up of traumatic exposures over our lifespan. Unfortunately, just because we get older doesn't mean that our symptoms, our trauma challenges go away. So symptoms associated with traumatic stress may not go away over time. And in fact, so you'll see the last bullet, as people who've experienced trauma grow into middle age and beyond, their trauma symptoms can come back, sometimes even when people are in their 60s, 70s, or 80s, or they can change. I've also worked with clients who had no trauma symptoms for many, many, many years and thought that they were healthy and had addressed their trauma experience in a healthy way, only to find out that with retirement or loss of a spouse or a friend or having to go into care, that their trauma symptoms emerge in a new way. So trauma symptoms can emerge in the context of social, financial, and physical changes, all of which are common as we get older. Symptoms of trauma can emerge for the first time, in fact, during older adulthood, decades after exposure to the traumatic event. Some argue that when we have new trauma symptoms in older adulthood, that those symptoms are experienced in an even more intense way. Unfortunately, with trauma, a history of trauma is also linked to a higher risk of many other physical illnesses, including heart disease, lung disease, and chronic pain. And as I noted earlier, those conditions in and of themselves also raise our risk for things like depression and anxiety and the other mental health challenges that we can see in adulthood. So now I'd like to spend a moment speaking about grief. Is grief a mental illness? No. Grief is a normal, typical way that humans and many creatures respond to change and loss. And we can experience grief at any time in our life. Grief is not necessarily a problem or a mental health condition. Grief is just the way we can react to change and loss. It's part of being alive, part of being human. Most of the time, grief itself is not a mental illness. Doesn't mean it's easy. It certainly isn't. In some situations, though, when a person's grief, their active grief, their full grief experience doesn't go away over time, but continues for more than 2 years after the loss of the person that they're grieving or the thing that they're grieving. We can diagnose or identify a person as experiencing something called a prolonged grief disorder. So most of the time, grief is normal, perhaps even healthy, and not something to be avoided or shunned, just a part of the human experience. But in some people, in some conditions, grief lasts a very, very long time, that we get past 2 years, and interferes with the way the person wants to live. Then they might develop what we would call a prolonged grief disorder. So the DSM, which is the kind of diagnostic guideline for mental health conditions that's most commonly used in North America, estimates that maybe between 7 and 10% of adults may experience prolonged grief disorder after the loss of a loved one. But the risk appears to be particularly high when we have been caregiving for the person who dies. So if we have been a caregiver and our loved one passes, our risk for prolonged grief disorder goes up. Okay, now I'm going to speak for a few moments about cognitive changes and dementia. First, I'm going to talk about what's a normal cognitive change? Is there anything, is there such a thing? Well, okay, yes. As we get older, our brains change, and that's normal and healthy and typical. So what we know is that as we get older, especially as we get into our 60s, we start to see these changes a little bit more. Our thinking speed tends to slow down. But some things also get stronger. It's normal for some types of our thinking abilities to change as we get older. So like I said, thinking speed and our reaction time can slow down. It can be harder for us to hear and understand speech and words, but some things get better. Our memory for words and concepts and lessons become stronger. We show a better acceptance of ambiguity and uncertainty. Some have described this as wisdom. We can become more wise as we get older. But the important thing I'd like you to take away is that dementia, which is a significant decline in our thinking abilities that gets in the way of our life, dementia is not a normal and inevitable part of aging. Will not happen to all of us and is something that requires medical attention and concern. So what's normal? What can we expect as we get older? Well, the good news is there are no mental illnesses or mental health challenges that are a normal part of aging. It is not normal to feel down as you get older. It is not healthy. It is not typical. It's not okay to have increased anxiety as we get older. Don't accept those as an inevitable part of your aging process. Likewise, don't believe that your memory is going to change just because you get older. That's also not a normal or typical part of aging. The tricky thing is that many of us as adults believe that depression, grief, and other mental health conditions are normal and unavoidable. But that's not the case. And the problem is, if we believe that, then we don't get help. We don't reach out. We don't get support when we do develop those conditions, because there is help for them, no matter how old we are. Here's a real catch-22 as well. Sometimes even worrying about developing dementia, remember I said a moment ago that dementia is not inevitable, it's not a normal or typical part of the aging process. If we get really, really worried about developing dementia, or if we get really, really worried about our physical health, that worry can become a problem. Which can become a problem, which then gets in the way of how we want to live. So if you watched my presentation on anxiety from earlier this afternoon, you will remember that the more anxious and worried we get, the harder it is for our brains to remember. And so if we get worried that we're really forgetful, we start to worry that we're becoming forgetful. The more and more worried we get, the more likely it is that we will be forgetful. And then the more worried we'll become, and then the more forgetful we'll become. So it can become a really tricky problem. If a 20-year-old came to you and told you, I forgot to take my medication this morning, but I'll remember to take it tomorrow. What would you say to yourself? You might say, well, he was distracted. He had lots of things on his mind. I bet you wouldn't say to yourself, oh, that 20-year-old should be careful. They may, I wonder if they've talked to their doctor about their memory problems. Maybe they have Alzheimer's. So in some way but for a 80-year-old who said, oh, I forgot to take my dementia, my medication this morning, we might have some of those thoughts. So it's a bit of an age-based double standard. Everybody can forget at any age, and becoming more worried about our health makes it more likely that we'll forget more. So I've really been talking about ageism. I'm going to take a moment here. So what is ageism? Ageism is a way to stereotype a prejudicial set of beliefs or discriminatory actions based on a person's chronological age. Age prejudice is one of the most commonly expressed prejudices and stereotypes. It is often ignored or even mocked. Think about the last time you went into the Shoppers Drug Mart or wherever to buy a birthday card for somebody you knew. How many of those birthday cards make fun of getting older and have pictures of older adults on them, as though getting older is this thing to be mocked or deplored or something, as if there's something bad about it. So age prejudice, ageism, is most closely associated with negative stereotypes or attitudes about getting older. Kind of as a culture, many people have come to expect bad things to happen as they grow into older adulthood. Thankfully, that's not the case for all of us. But if that's the case for you, you should know that having ageist beliefs and negative expectations about what aging will look like for you also raises your risk of mental health challenges as you get older. Okay, medication and mental health. This is where we're going next. Similar to how our body processes substances, like recreational drugs, alcohol, our body's ability to process medications also changes as we get older. So our ability to metabolize and get those medications out of our system changes as we age. Unfortunately, this can raise our risk for side effects because the medications can stay in our system longer and they're broken down in different ways by our bodies. The other thing, as we get older, as I said, we're more likely to develop chronic health conditions, and we're more than likely to be on multiple medications. And by that, I include both supplements, not just prescription medications. So we are more likely as we age to take more medications, which increases the risk of those kind of medication interactions with each other, not to mention how our body metabolizes those medications, which can lead to distressing, harmful side effects. I raise this because some of the side effects that we see from medications as we get older can mimic or contribute to mental health challenges like depression and anxiety. Specifically, medications, including those that are used to treat heart disease, mental health conditions, we call those psychotropic medications, like medications for anxiety or depression, medications that treat pain, and several other chronic health conditions are at a higher risk for causing those negative side effects as we get older. I always encourage you to speak with your prescriber if you have questions or concerns about potential side effects of your medications. It's always okay to ask and have that conversation with your nurse or your doctor or your nurse practitioner. So what do we do? How do we stay well? Regan, you've told me all sorts of things about mental health challenges as we get older. What can we do to make sure that we maintain our mental wellness? Well, the good news is we have some of that information too. Here are some well-established mental wellness promoting factors. So these are things that you can do to keep your mind and mood kind of well as we get into middle age and older. One of the most important mental wellness promoting factors is social engagement and connections. So making those meaningful relationships in our communities, having places where we feel welcomed and valuable and important and connected. For some of us, this isn't going to be with our biological family. Maybe they live on the other side of the country. For some of us, these will be connections and families that, family that we make or family that we choose or organizations that we become a part of. But deepening your social engagement and connections, not necessarily including your social media presence, but like real in-person, COVID allowing connections and relationships. Another robust wellness promoting factor, super well validated, is physical activity. And when I say physical activity, I don't mean running the Yukon Ultra or skiing in the Loppet, skiing the full Loppet, or even going to the game center and getting on the treadmill or on the rowing machine or walking around the track. Physical activity doesn't mean we have to be an athlete. Physical activity can just mean moving our bodies more, whether that's walking to get our mail, doing our housework, shoveling, moving our bodies more. And the neat thing about physical activity is we would say dose dependent. It's a silly way of saying the more you do, the more protective it is. But any physical activity helps. So don't limit yourself in becoming physically active by saying, well, I can't go to a Zumba class. I could never make it all the way through, because you don't need to be able to do a Zumba class. Just do what you're doing, but do a little bit more. Another wellness promoting factor is cognitive engagement. What does that even mean? Thinking more and thinking in different ways. And what I like to say is it's especially helpful if you can think and move your body in a new way at the same time. So my grandmother, God love her, I miss her a lot, used to do a crossword puzzle every day. And then after a while, she got bored and she did a Sudoku puzzle every day. And she really enjoyed those things. And that's great. She enjoyed them, so they were meaningful. But the research data would suggest that doing the same thing over and over again, like my grandmother doing a crossword puzzle every day for 5 years, if you keep repeating the same type of activity, it's not as protective. It doesn't have the same kind of benefits. So doing new things fairly regularly, like, again, moving your body, getting out on the land in a different way, doing another type of sport or exercise, learning to drum, learning to play a different instrument where you have to be thinking and moving at the same time. Super protective, really good for mental wellness. And then, of course, the other important thing is having regular contact with your primary care provider to manage some of those other maybe chronic health conditions. Certainly not all of us are lucky enough to have a physician. And that is a real gap. But you don't need a physician. Let's say you're in one of the communities, you can access your nursing center, or maybe you can access a different type of care provider. So regular access to primary and preventative health care is another wellness promoting factor for your mental wellness. So if we were in the room together, or if we were able to do this together live, what I was going to have you do is make a plan. But maybe it's even better to have this presentation recorded, because you can stop me, you can pause me anytime and make your notes. So what I'm going to ask you to do is grab a piece of paper and a pen and think about, for each of these wellness promoting factors, what could you do? What is one small step you could do? It has to be small enough that you can do it easily. It has to be timely. So not that you do it in February, but that you could do maybe in the next couple of weeks. What is one thing you could do to connect with others in your community? So pause me here, take a piece of paper, and maybe do some brainstorming or some writing down, and pick one thing you could do and make a commitment to doing that. Next, how could you move your body? What could you do tomorrow or the next day to move your body just a little bit more than you are already doing it? Like if you're already training for the Yukon Ultra, more power to you. That's awesome. But that doesn't work for me. Maybe for you, it just means walking around your yard one more time, or walking to get your mail and back twice, or doing some arm raises or leg raises in your chair when you weren't doing them before. So take a moment, pause me here with your piece of paper, write down all the different ways you could just move your body a little bit more in the next few days. Now circle one, and I hope you can do it. Okay, this is my favorite one to do. Although for many of us, it can also be the hardest. I'd next like you to think about, what can you do that would make you think? What could you do that was fun, like silly fun? Or what could you do that was interesting, that caught your attention? So grab your piece of paper. If you're watching this in a room with somebody else and you can chat it out, that could sometimes help. But brainstorm a list. What could you do tomorrow for yourself that was fun? What could you do tomorrow that would make you think? What could you do that would be interesting? And again, I want it to be something you could actually do in the next couple of days. So write down your list and then circle one thing. Okay, last one. If you are lucky enough to have access to primary care, a physician or a nurse practitioner, or at a nursing station, think to yourself, when was the last time you went in for just a basic checkup? Not to talk about a specific issue, but just a basic checkup. When could you make that appointment? Who would you need to call? So think about that. You take your paper out again if you want. Who would you call? What number would it be? Maybe write down the number if you have it. And then make a plan. When are you going to make the call? And maybe circle that and move it over to your calendar later. And maybe as you did this, you found that one of these 4 activities was easier than the other. That's often the case. We'll all have one of these that was easier than the other 3. What I would encourage you is that if one of them was easier than the other 3, that's a great place to start. But that makes it even more important that you go back to the other 3 and you do those 2. So we all have ways that we're comfortable of being in the world, but we get kind of better protection, more. I suspect if one of these 4 plans was easier for you, you're probably already doing some of this stuff. So it's going to be even more effective if you incorporate something else, whether it's a plan to move your body more, to connect with the community more, or to do something that's fun, interesting, makes you think. So that's it for me. I do appreciate your attention. I hope you did pause me and make a plan. And I hope you enjoy the rest of the conference. Once again, I'm sorry we weren't able to interact together this evening. I hope you have a great rest of the day. Thanks so much.